There's a pain at the carpometacarpal joint as well as the metacarpophalangeal joint. These are the two joints which are attaching to the muscle. It's always better to carry a stick when we are traveling. Hi, I'm Dr. Tahmina, your physio fitness and rehab expert. We are going to talk about hand injuries. There are various types of hand injuries which can happen because of the fall. Like most likely it can be a fracture and dislocation also, but apart from that there can be soft tissue injuries, there can be muscle strain or a ligament sprain, or there can be conditions like we call a compartmental syndrome where the tissues, the nerves, the muscles, the blood vessels also sometimes around the wrist. So that we'll see with Mr. Kothari today. अभी फील हो रहा है ये सब
ये हाँ दर्द कुछ नहीं है
अच्छा
और यहाँ भी नहीं जब बेंड करता हूँ
जब बेंड कर रहे तब आपको ओके ओके there's a pain at the carpometacarpal joint as well as the metacarpophalangeal joint. The flexor muscle, as we see, has to move in the thumb. These are the two joints which are attaching to the muscle. It's always better to carry a stick when we are traveling, but if we are traveling to maintain the balance or to have that extra support and confidence, it's always better to have a stick. Many people, they try to avoid stick because they feel it's a cosmetically maybe they don't look good, but that's not right. Prevention or precaution comes first. Third day, percentage wise, Mr. Kothari, how do you feel?
I would say 7 I have recovered.
Okay, that's great. So in 2 days only he's recovered by 70%, and hopefully after today he'll recover by 100% after today's session gets over. So after we finish this, we'll try to see how his movement has changed. So now we'll see the movement wise how better it is. This thumb has to be moved. So we need to do few exercises also, like it goes into extension has to be done of the thumb. We'll have to do flexion, moving it inward. So this movement is adduction. This is along the plane, and this was extension. Moving it up and down is extension, and this way it is flexion, inward, this way across the plane. Now there's also, we can see because of the fall, there's little bruising over the knees. You can see, which is gradually healing. It was bad earlier, so we'll have to put it here, somewhere here.
Here.
Yeah. So we'll also put 2 pads over the like thumb where he was having the pain. So as I said, this joint, carpometacarpal joint. So we have covered both the joints which got little strained. Yeah. Okay. So we are trying to relax the muscles and thereby enhance the healing process by using IFT. So how is it feeling, Mr. Kothari, now after the treatment?
It is quite getting better.
Okay. So we can see that he is able to move the thumb inward. Mr. Kothari, in 3 days, how do you feel? How much improvement is there in your hand? The pain and all?
70%, I think.
It's much better. Okay. So that's great. So here in 3 days, he is feeling 75% better already. So I'm sure in another 2-3 days with movement and exercises which I've shown him, he'll be 100% pain free. So thank you, Mr. Kothari.
Thank you very much.
Thank you.